The state continues to see a rise in hospitalizations. They have gone up by more than 470 since a month ago. Meanwhile, concerns continue over the Omicron variant. Joining us now to break it all down is Dr. Jennifer Martin, Interim Chief Medical Officer of Trinity Health of New England. Dr. Martin, thanks so much for taking some time to be with us.
Thanks for having me, Erin.
So I think these numbers are a little bit concerning, especially with the fact that many of us plan to get together with some family members maybe we haven't seen in a while. Yesterday, we were over 8% in terms of our positivity rate. Today, we are over 7%. What are these numbers linked to? Is it because of this new Omicron variant?
It certainly could be related to it. We haven't, yet seen the breakdown here in the state of Connecticut. We know that we're not seeing the numbers of booster shots that we'd like to see in everybody. So I think there's some relationship to that. We also know that people are out and about and doing more and perhaps being a little more lax when it comes to wearing masks. So I think all of those things together, and to your point, we are gathering more. It's the time of year when people gather and getting lax about it, not necessarily gathering with people we know are negative, maybe not testing beforehand, not wearing masks if we're indoors with large groups. All of these things combined could be leading to the increased numbers that we're seeing.
Also, in terms of hospitalizations, I mentioned that those are up as well. What do you think is causing that? Some of the same things you just mentioned?
I think many of the same things we're seeing. We know Delta is still out there predominantly in the state of Connecticut, and we know that unvaccinated people that get COVID get sicker, and we know they require the resources of hospitals and ICUs and other resources above and beyond. So we're still seeing the disease spread, and we're seeing people get sick and die from it.
In terms of who we're seeing in the hospital, is it primarily those who are unvaccinated right now?
Yeah, approximately 75% of patients admitted to the hospital presently are unvaccinated or incompletely vaccinated. When we look further at the ICU patients, it's about 80% of them are unvaccinated patients. So we know that vaccinations and boosters prevent us from getting that severe disease that will require us hospitalizations or ICU admissions even.
Yeah, another reason, an incentive to go get that booster if you're more than 6 months out from your shot. Dr. Jennifer Martin, Interim Chief Medical Officer of Trinity Health of New England, thanks so much for sharing your expertise with us. We appreciate it.